All right. I can do the commercial. Is this thing on? Can you hear me now? Can you hear me now? Just kidding. Well, first of all, I want to say good evening to everybody, and thank you for being here. We wanted to try to start promptly, even though I was running a little late, but got here just in time. I want to welcome you this evening. Tonight's going to be an informal kind of presentation about the importance of our healthcare system here in Prince George's County, and particularly the new agreement and partnership that we have now between Prince George's County, the state, and the University of Maryland medical systems. And so I want to welcome you this evening. We'll have a host of speakers as well, but I did first want to bring up our co-host for tonight's activities and have the mayor introduce the other members of the council who are here. And I think it's important, obviously, the Bowie Health Center and its important and history here to the city of Bowie. I noticed that Audrey Scott, former mayor, former county council member, and I think the mother patron of the Bowie Health Center has come back. Good to see you as well. And so in some ways, we're continuing your legacy of work with this new partnership that we have with the University of Maryland Medical Systems. So with that, let me bring up Mayor Robinson and so him to bring readings on behalf of the city. Thank you.
Thank you, sir. Welcome, everybody. Welcome to beautiful downtown Bowie. If you haven't been in this building before, take a few minutes to look at it. We've been talking about it when he came in. I kept telling Audrey came in here and said, "This is the council room?" Remember the older days, this is a big, big change. And I told her, it damages my delicate male ego to let you know that the person that designed and built this was one of the smartest young women I ever met. And I will tell you that when we talked about it at the very beginning, he said, you know more about stacking bricks than I do. But I know that open is better than closed, and windows are better than walls, and light is better than dark. And then Audrey and Mallory, because I said, before you design the city council room, I want you to go down and look at the county council room. And we want ours to be exactly the opposite. You go there, it's very nice, it's very pleasant, it's very formal, it's very professional. It's got dark paneling, dark upholstery, and indirect lighting and stuff. You got a whole wall, whole flat. And outside that wall is the roof of the ground stairs, the building downstairs, and it's got a planting door. It's the most energy efficient building we've ever put up. So when I start blowing gas out, everything is better. But I got two colleagues here. And Jimmy Marcos, you guys know, Jimmy goes back to the bathroom. Yeah. Helps us here forever. I think Jimmy served on the commission over there for like the Civil War. And Diane Planger from District 2, I think she's coming. We are big boosters of this system and this improvement. We have been big boosters, obviously, of Bowie Health Center. For us, the big change, and the most effective change, when it went to 24 hours a day. Because, we're a city of 60,000 people. And we need that medical service, and we need that on a predictable 24-hour day basis. And the quality of service we get out of this facility is remarkable, and it's dependable. And, you go in there, and everybody has the same challenges, Sometimes you go in there and you're hurt, but somebody else might have a more serious problem, we'll make those adjustments. But all the feedback I get back from people is that, for a terrible incident, the experience wasn't as bad as it could have been. So I want to welcome you tonight. I want to have a nice conversation and move this thing forward. I am looking forward to the day when this magnificent system actually starts coming up as brick and mortar, and we can start moving and just keep going with that. So if you want to take some time to wander through the building or something and look at it, if you do this time of night, if you go through any hallway, it'll be dark until you walk in them, and then the lights will come back on. And then when you walk out, the lights will go off, which is tough when you're in an office. If you're thinking about something, the lights will go off. I don't know if that's the message you're sending me, but it worked out. So thanks for coming tonight, and I will turn back over to Todd, and because the county council is going to fund everything. Whatever your budget is, 150%. Right, Todd?
That's right.
Good evening, folks.
Good evening.
Thank you, Mayor.
For being such a gracious host. I don't get to come back here as much as I used to, but at least they took my name down. That's a good thing. So
We did that the day you left.
I know, yeah, I heard.
Well,
But,
I
sure.
forgot to introduce you. Some of you haven't known our new city manager, Alfred Locke. Alfred's been with us since the first of the year. He came to us from Georgia. Any of you lived in the South? You know they have a different language? You know how they spell Georgia? J-A-W, J-A-W. Where are you from? I'm from Georgia. Georgia. Anyway, so he's adapted very well here, puts up with all of us very well. He's a retired Army colonel, so we all just snap around and salute and all that other stuff when it comes through. But he's done an incredible job taking over here and moving the city forward. So, if you have any questions or any problems about anything at all with the city, see ya.
Thank you, Mayor. Appreciate those comments. And Mr. Lott, I know you're coming up on your year anniversary almost, so congratulations on that. What I just want to briefly do, and just say this. In 2000, obviously the Bowie Health Center and Dimensions Health have been an integral part of our public health care system here in Prince George's County for years. And what we're trying to do is build upon that and strengthen that through the partnerships that we have. Now, most of you recall my predecessor, Ingrid Turner, when she was chair of the County Council in 2012, entered into this historic agreement between the state, Prince George's County, University of Maryland, to develop what would become now, 5 years later, the Regional Medical Center for Prince George's County to replace the Prince George's Hospital at Cheverly. And so I know it's been a hard road, and we'll hear a little bit about that this evening from our speakers, how we got to this point. But I do want to thank the efforts on behalf of all of us, including the City of Bowie, our state representatives, our county representatives, the county executive, to get us to this point where I think we now will be embarking on a new partnership to provide the best healthcare system we can for our residents of Prince George's County. And I say system because everyone's enamored about potentially the new hospital, new regional medical center at Largo. However, we have parts of the system that UMS has formally taken over as of September 1st of this year. And so integrating those parts that were part of the Dimensions healthcare system into the University of Maryland medical system is what we're embarking on now. And so that partnership is something that we're very excited about in Prince George's County. So with that, let me get straight to our list of presenters, and I'll just list them for now, and I think Dr. Moore will be coming up, Mr. Moore will be coming up to start off the presentation, but they each have a role in it. And for those who don't know, Neil Moore is the President and Chief Executive Officer now of the University of Maryland Capital Region Health, which is what the system is now called. I'm sure many of you have seen the advertisements that have been going on in local newspapers, the radio ads, billboards. So they're rebranding our system as part of that. And so he will join us shortly. We also have representation directly here from the Bowie area on the University of Maryland Medical System Board, and they will also be providing a presentation this evening, and I introduce Mr. Orland Johnson, who's right over here, and then, good evening. One-man band over there, Jimmy. And then we also have the Honorable Alex William, who has a long distinguished history serving this county. In addition, thank you for being here. We'll have Mr. Mark Wasserman, who's Senior Vice President of External Affairs for UMS, and as well as Mr. Jeffrey Johnson and Ms. Tiffany Sullivan, both of the University of Maryland Capital Region Health. I'm still getting used to it as part of this process. So let's sit back. We do have a copy of a presentation. Hopefully each of you have that. If you don't, we make sure you get a copy of it. I think it's up here. With that, let me ask Mr. Neil Moore, President and CEO of University of Maryland Capital Region Health, to come up and give us his presentation.
Councilman Turner, thank you very much for the introduction. I remember it was about 4 years ago or so when I last came to this room, this council, and presented on Dimensions healthcare system at the time and talked about all the plans that were underway in building a regional medical center and also improving the delivery of healthcare services within Prince George's County in southern Maryland. And you mentioned the system. It is a system, and so when we think of the regional medical center, we don't think of just one hospital being Prince George's Hospital, but we think about all the facilities associated. And more importantly, we are now delighted and happy that we have a partnership with the University of Maryland Medical System. I think you'll be pleasantly surprised from when I came here about 4 years ago to where we are today in terms of the progress. We all know that we're a partner with the University of Maryland Medical System, but you'll hear about some of the things that we have done within the healthcare system, some of the things we have done within each of our facilities to get us to the full transformation of healthcare services so that we can be responsive to the needs of the residents that we serve, not only in Prince George's County, but in the southern Maryland region. Since we've had an introduction of the speakers, I wouldn't go any further, but I would turn the mic over and have the second speaker come up and talk to you about our healthcare system.
Thank you, Neil. Appreciate that comments as well. Next, I have on our agenda Mr. Orlean Johnson, who's a member of the University of Maryland Medical Systems Board of Directors and also happens to be a long-term Bowie resident as well.
Thanks a lot, Todd. Hey, good evening, everyone. You know, it's a pleasure to be here, and when I think about some of the activities that we've been thinking about in our city for a long time, and I think it was apropos that everyone had a chance to mention Audrey Scott and the work that she has done to really begin this process. But as a long-time resident of Prince George's County, probably over 30 years, and I think I've lived in Bowie now for over 20 years, the idea that we would ever see what I would call a first-class healthcare system that's coming to Prince George's County, where we're going to see implantations of it here in Bowie and in other parts of the county, has really been something I'm not sure I would have thought I would have seen in my lifetime. I think we've been talking about first-rate health care for probably over 50 years in this county. And I'm glad to say that I believe today that this is something that's going to be extraordinary in terms of what we're looking for. I've gone to testify a number of times, and one of my favorite lines is I've told people I've had 3 children that have been born since I've lived in Prince George's County, and not one of them has actually been born at a hospital in Prince George's County. And as many of you know, we have a lot of healthcare delivery that takes place outside of the county because people have figured out how to go to get what they need. That's not going to have to happen anymore. One of the things that I'm extremely excited about is not just having a first-class healthcare delivery system, but also the interaction that we'll have with the School of Medicine that will be here. The ability to be able to attract doctors that want to come and be part of first-class medical operations. And, you know, many of you may not know, but I also chair economic development for Prince George's County, and one of the struggles that we have is a shortage of doctors. Part of what we're looking for is if you can attract what I would call great facilities, that's how you get a chance to attract great doctors. And to put us in a position where we become first in class, where someone would want to come and practice. And we all know that when you come to visit here, you can't leave here. So the idea is if we can get you to come see where we are and understand what we do here, that you won't leave, and that will help us to take care of some of the shortages that we've taken care of as well from a doctor's standpoint. The other thing I'm really excited about is really what, in particular, the regional medical center is going to do for what we call downtown Largo from an economic development standpoint. We've talked for years about development as it relates to metro stops and things of that nature. Well, now if you look at downtown Largo, and one of the things that we've been talking about is how to create a smart city there. You have parts of the administration that's going to be coming down there. You have government offices there. You're now going to have a full-fledged medical system that's right there, a repurposing of the mall that's sitting right there. So before you know it, these are the types of things that drive economic development, putting us in a position where we can be able to show the world what we have going on here. And the last thing I'd like to mention, and many of you may not be aware, but the way the system really works, and I think I've been on the board now for about 5 years, we have what I like to call a hub and spoke system. So, for example, out in Baltimore, you have the University of Maryland
you've done it like 50
that actually
times,
almost acts as what I would call the hub, where a lot of activities end up coming into the hub from some of our other hospitals in the system. Well, this hospital that's going to be in Prince George's is going to be what I would call the second hub of the system. So from there, we are looking at this being something that will be able to attract services even from southern Maryland and other parts of Maryland. And sometimes you'll have to helicopter in some of the services that are going to be needed at this particular facility because it's going to be the facility that will be the other hub of the system. So we're not just simply talking about another medical facility. We're talking about a medical facility that's going to impact not only Prince George's County, but it's going to impact the state in a substantial way. And I've been extremely pleased to be a part of this organization. The work that we've done in the area of our vendors and MBE work that we've done has been substantial. We operate at numbers probably in the high 20s in terms of what we do with MBE, women-owned company, African-American company, Asian companies, Hispanic companies. So even in terms of just the ability to be part of a community, I like to say we don't just want to be in the community, we want to be of the community. And that's what I believe that we're going to see once we get our chance to be here. But I just wanted to give you a chance to say, as a Bowie resident, I look forward to it. I can't tell you how many times I've been across the street there for good times and for bad times, but it's always worked out in the long run. But we're looking to, as you'll see from our presentation, do even more investments that are going to be over there, expanding the waiting area, making it a place that you may want to hang out for a very long period of time. But we look forward to it, and I look forward to just continuing to be here in the community. Hopefully I'll see people around, whether it's at the grocery store around town. If you have any questions, look forward to letting everyone know what's going on. But all I can tell you is this is an exciting time for Prince George's County and even a more exciting time for the city of Bowie. Thank you very much.
Thank you, Orland, for those comments. I'll say two things. You remember that I'm dating myself a little bit, but you remember that commercial? It said, I'm not only the president, but I'm also a customer. So I say that also as someone who's gone to the Bowie Health Center to use the services there, as someone and gotten great service there. We understand the importance of making sure that everyone feels that way when they come into our healthcare system. And I did forget to mention, we are live streaming this and is being recorded, so we'll be able to replay it for those who are not able to join us this evening. Next, I'd like to introduce the Honorable Alex Williams, who's also a member of the board, longtime public servant here in Prince George's County, and I could say a real advocate for the county as well. So, Judge Williams, thank you.
I want to say thank you to the Councilman Turner and for his work in making sure that this project continues on, and he and the other members of the council and the county exec have been forceful in making sure that we have quality health care here. Let me just say just a couple more things. I'm not going to repeat what Orland Johnson just said. I haven't been on the board as long as Orland. I've only been on there about 2 years, and I have been in Prince George's County about in Bowie about only 3 years. My wife is here in the back, and we just hear new residents. I will say that Orland and I are probably the only two Prince Georgians on that board. We're probably right there. We're the only two on this big board. And so both of us live in Bowie, so we are very, very concerned about making sure that Prince George's County gets what it needs. I'll tell you a little about UMS. UMS includes 14 hospitals in the system. It's a very large system with a budget of over $5 billion and $500 million in annual revenues. And historically, let's be perfectly honest, historically, Prince George's County has not received the kind of resources that the other parts of the state have had. And my argument at all these meetings is that if you look at what's on the western shore, the eastern shore, upper Chesapeake, and so forth, all of those counties together do not come up to the 1 million people and citizens almost in Prince George's County alone. And we need to make sure that the dollars and other sources of spending and revenues in this state, in this system, come back to Prince George's County. And the bottom line of all of this is that we want to have a system here where folks won't have to go downtown in D.C. and in Montgomery County and Anne Arundel County to look for the delivery of health care. We want it here, and we're going to get it here. has a high bond rating from the bond agencies. It's an A. And I can tell you right now, and in my short period of time there, the leadership of this system consists of some wonderful people, not just Neil Moore, who operates the local system here, but the entire system is run by wonderful people. Our system is nationally recognized partly because of our important tie and the collaboration and partnership with the University of Maryland Medical School. And that medical school, I don't know whether you all know it or not, but it's the eighth, it's ranked number 8 in the country of public hospitals, public medical schools rather. And in the entire country, they're ranked in the top 25 of all private and public medical schools. So this is a big deal that's coming here. We're talking about a system that's going to bring their researchers, their doctors, their surgeons, and then all their doctoral fellows, and all these people are coming here and they're bringing these resources here to this area. The workforce includes nearly 3,000 full-time, part-time, and adjunct faculty, and a staff of another 3,000 plus and so forth. So again, this is a big thing. I'm going to continue to tell the people around the county that look out, there's going to be a great medical system here, and all of the diseases and other illnesses that heretofore we had to go downtown to get, they're going to be dealt with here. I'm talking about cancer treatment for pancreatic and liver and colon and transplants here, infectious diseases, mental health challenges, strokes, heart problems, and I'm part now of the baby boomers generation, and we're getting sicker. And that means that we want to make sure that we have a quality program and system here that's going to take care of us and children and so forth. So I am really excited about what's happening here, and I wanted you all to certainly understand that we're bringing in a beautiful system here in this county that's going to take care of over 1 million people in this area for their health needs. So that essentially is what I wanted to say. I want to thank all of the people here that's getting behind us. I've known Audrey Scott for so long. One of the problems in this county didn't make her the county exec, you know, years ago when she was up and running for it. I've known Mayor Robinson for a good amount of years. He and I were in law enforcement together years ago when I was the state's attorney, and he was running a good part of the police department. And so, Councilman, thank you for bringing this group here, and let's spread the word that we've got a great delivery of medical services here now, and this is a great day for the county and for this region. Thank you.
Thank you, Your Honor, for your efforts. And I will say, I think it's something that you both said in your comments. You know, we're looking at it in different, we can look at it in different kind of ways. One is obviously the quality of the healthcare system that we expect and deserve as residents of Prince George's County, and the quality of that service that we provide. The other part of that is also it's an economic engine. You know, as Orlin knows, as a member of the Economic Development Corporation, we did this 5-year study, 5-year plan for economic development and trying to develop those areas that we wanted to develop in Prince George's County. And the healthcare system was one of the top 5 as part of that. So we see this as an investment not only in the health for our residents, but also as the driver for economic development and the ancillary businesses that come with having a healthcare system centered at a new regional medical center. So we have good opportunities on both sides of those. So let me now turn over the program to, I know, one of the hardest working men I know in the last couple of years in dealing with the county executive, the county council, and making sure we all come together to where we are today. Introduce Mr. Mark Wasserman, who's their Senior Vice President for External Affairs, I guess, and to start the presentation. Thank you, Mark.
So, good evening. Thanks to everyone for turning out. I have a couple of personal comments, and then I'll start cracking into these slides here. First, let us thank Tamika Bumbry and Councilman Turner for helping us gather you all together here. We are anxious to have at you. We are anxious to embrace the Bowie community. We are, as you can see, we're blessed with some really committed Prince George's Countyans and Bowie residents on our board. I asked them if they would be willing to do this. They always say yes. These are serious boosters for Prince George's County in our complicated world, which I'm about to explain to you. One person who hasn't been introduced is Dr. Trudy Hall, yet another Bowie resident. Trudy runs our Laurel Regional Hospital and is a source of great strength for us. I want to throw a bouquet a little bit to Councilman Turner. In coming to know him, he's done two things which I've found admirable. One is to be a champion for the Bowie community, at the same time being visionary enough to see what it is we're trying to do countywide. Hopefully we'll give you a little more insight here in a second. Final thing, and I don't want to make more out of this than is probably appropriate, but I grew up here in Bowie at 2921 Blueberry Lane. Yeah. So, when we can gather the troops, we do. Hey, what are we going to do? So what I'd like to do now, because the message that we're bringing to you is, well, what is OMS, which is this big corporate entity, and then take it down to our partners, the affiliate, where you really need to connect, which is Capital Regional Health. Meet some of the key players there. You've met Neil, and understand what they're thinking about how we should be moving forward here in Bowie. So with any luck, you're ahead of me here. Okay, so that's my job, to see if I can impart to you, and Alex went a fair ways to do that. So just a little bit of background here. So a couple of takeaways. The University of Maryland Medical System is a private nonprofit. It's a 501c3. It was created by an act of the Maryland General Assembly in 1984. And today, as you heard from the scale that Alex was describing, it is a whopping privatization success. So we are this unique animal in that we are entrepreneurial. We have a very special mission, and it sets up a tension between having to be businesslike, but never forget what it is we're supposed to be doing. And whatever your frame of reference is to healthcare, it's incredibly challenging right now. So we have jumped off the diving board. We're plunging into Prince George's County in a world where we're going policy-wise with healthcare is an unknown. Our board has stuck with it, and we are ready to grow. We are ready to bring a new brand of healthcare to Prince George's County. So we are a 501c3, and this is our mission. So this is what we aspire to be. The premier healthcare system serving Maryland. The word hospital used to appear in that mission statement. Doesn't anymore, and you're going to learn a lot more from Tiffany in a minute, because this healthcare is evolving, and our job is to keep you healthy and out of our facility. Our focus is Maryland. As both Alex and Orland were pointing out, if we say our focus is Maryland, and there's almost 1 million people in Prince George's County, we need to be here. And so we are arriving in a pretty significant way. So Alex began to spin this out for you, and I realize this is a complicated graphic, but what it's intended to do is show you how we interact with the University of Maryland. And our primary partner is, as was pointed out, and I'll get into a little more detail here, is the University of Maryland School of Medicine. We have Trudy is a credentialed faculty member. We are bringing academic medicine to Prince George's County, and it will draw on the fundamental strength coming from the University of Maryland School of Medicine. I don't think there's anything quite like this going on in Prince George's County. It is our opportunity. And as Orland pointed out here, This is going to be a very different, major statement about bringing healthcare with an academic flavor to Prince George's County. We have a number of other connections within the university system. As you may or may not know, in Baltimore, all of the allied health professional schools are arrayed around the state's academic medical center. Nursing, dentistry, medicine, social work, pharmacy, law, and they all use that facility to train the next generation of healthcare providers, to conduct clinical trials and research. It's a very special breed of cat, and we are going to bring a version of that here to Largo. We also connect with College Park, and we want to meet that dynamic new president of Bowie State University. We've heard terrific things about. Tie into there. There's a nursing school there. We want to make some friends. So I'll leave you to look at the rest of this for a second here, but we are spread across almost the entire state. Eastern Shore, northeast corner, city, Baltimore County, one of 2 hospitals in Anne Arundel County, maybe significantly for what could lie ahead here, the hospital in Charles County. So actually, when we first went to Charles County, we said, how will people who live in the Washington metropolitan area, who root for the Redskins, who read the Washington Post, how will they react to a Baltimore-based organization? And we received a lot of encouragement. At the time we did that, we wondered whether people would want to come to Baltimore for the most advanced kind of care. At the time, about 40 patients a year were coming from Charles County to Baltimore. Today, that number is over 700. So the synergy that we're looking for, the ability to bring academic medicine to you is an opportunity. I'm going to keep moving here because this is further reinforcing the message. Residents of Maryland, you have a fabulous school of medicine serving you, but it's old. It is on a trajectory to be one of the really national leaders. One thing you may not realize is that you may think the School of Medicine, big, bold organization, there's only 150 physicians they're turning out every year. And to the point that was made earlier, by exposing the residents and fellows within our system to Prince George's County, it's going to give us here in Prince George's County a leg up in keeping them here and attracting them here and encouraging them to be part of something big and bold and innovative. This is what we believe sets us apart. Our focus is on Maryland. We are about discovery, taking the fruits of research and applying them to the bedside. And most importantly, there's nobody else in the state of Maryland who bears that last mission, produce the next generation of healthcare providers. That's it, although I did want to throw a bouquet to Audrey. Audrey has been encouraging us from day one. Frankly, I'm a little surprised to see her here. I now connect her as much with Kent Island as I do with Bowie. So Audrey, thank you very much. Councilman? Yeah, I can do it for you, whatever you like.
Thank you, Mark, for the introduction of the larger system here. And next, we're going to ask Mr. Jeffrey Johnson, who's the Senior Vice President for Strategic Planning and Business Development, I think has the next part of the presentation to talk about what Capital Region Health is and can be. Jeffrey.
Thank you, sir. Good evening, everyone. So what's really exciting for us is that on September 1st, the old Dimensions Health Care System, formerly affiliated with the University of Maryland Medical System. And with that came a new era, some exciting times, a new name, which we're now University of Maryland Capital Region Health. But we want to take a few minutes to tell you who we really are, because a lot of people don't really know the broad scope of services we do have in the health system here in Prince George's County. So basically, we have two hospitals, Prince George's Hospital Center, which now is named University of Maryland Prince George's Hospital Center, University of Maryland Laurel Regional Hospital, and then here at Bowie, we have the University of Maryland Bowie Health Center, which is our emergency center, as well as University of Maryland Capital Region Surgery Center. And then throughout the system, we have the Capital Regional Health Medical Group, which is all of our primary care, specialty care practices throughout the county. So we'll start with one of the most important ones here, with Bowie. And basically, again, we have the emergency center here, the surgery center, the Mulliken Medical Office Building, which has quite a few different types of community practices, as well as some practices associated with the University of Maryland School of Medicine, and Larkin Chase Rehabilitation Center. And we'll talk a little bit more about this in just a second here. So first of all, let's go with University of Maryland Prince George's Hospital Center. This center has approximately about 50,000 emergency visits a year. It is a level 2 trauma center, which a lot of people don't recognize that or realize is that it's actually the second busiest trauma center in the state, second only to Shock Trauma Center at University of Maryland Medical Center. With this, we're also a designated stroke center, designated chest pain center, and we also have a level 3 NICU, neonatal intensive care unit, which is the only one in the county here, as well as having a significant, strong clinical residency program for family medicine and for internal medicine. So a lot of education, medical education, happens here at Prince George's Hospital Center. At Laurel Regional Hospital, this is a 61-bed facility, a smaller hospital. At the same time, it does offer some specialty services, such as acute rehab and chronic care as well. And it sees right now, currently, about 26,000 emergency department visits a year. Our medical group, we have a number of locations, and it continues to grow. We currently have primary care practices in Suitland, Cheverly, Laurel, and we have specialty services also at in the Capitol Heights area, Greenbelt, and Bowie. Again, we offer family medicine services, internal medicine, obstetrical services, and those are soon to expand here in Bowie, pulmonary medicine, plastic surgery, and other types of services of specialists that are coming in to the county from University of Maryland School of Medicine, providing subspecialty services that we have not had before. So what this really is all about is the transformation of care for Prince George's County. Some of us in the room have been working on this project since 2011, of trying to develop a more robust, financially viable healthcare delivery system for Prince George's County that would improve access to care. And certainly one of the things that we've been focused on is trying to promote primary care. The county has had a significant shortage of primary care physicians, so we've been working with the county to try to help address that. And also with the help from the School of Medicine, they have helped us to staff some of our critical services, such as the trauma program, such as emergency medicine. So at all three of our emergency centers, we have University of Maryland trained emergency physicians there, which we feel has really made a significant improvement in the care of emergency services for our community. We also have cardiac surgery with Dr. Brown. Dr. Jamie Brown is a nationally known cardiothoracic surgeon, and he's led the way to basically completely transforming the cardiac surgery program at University of Maryland Prince George's Hospital Center. In fact, at this point now that the cardiac surgery program at the hospital is ranked among the top 10% nationally of all coronary artery bypass surgery programs. So that's something to be very proud of. And this is just one example of the transformation that the University of Maryland is bringing to medical care for the residents of Prince George's County. This is just a list here of some of the types of physician specialties that the University School of Medicine has been bringing to the community thus far, and we believe that this will be expanded upon, working collaboratively with existing community physicians here in Prince George's County. So one of the things that we're certainly proud of within University of Maryland Capital Region Health is our new medical center that will be replacing Prince George's Hospital Center. And to give you a perspective here, in case some of you aren't familiar where this is going to be located, this is really off of 495 by the Capitol Boulevard. And this right here in the red is where the center will be going. This whole area here will be completely redeveloped for residential and commercial. And this is a whole Largo Town complex, which is a huge economic project for the Prince George's County. And so you can see here we're close proximity to FedEx Field. And right here is the metro line. So one of the reasons why we chose this location was that it had easy access to the residents of Prince George's County using the metro. So just to give you a little bit of what this center is going to be, it's going to be about a 205-bed facility. In addition, it will have 15 beds from Mount Washington Pediatric Hospital. That is a specialty pediatric hospital that takes care of small premature babies after they've been discharged from the neonatal intensive care unit. It's a very important service that's provided for Prince George's County residents as well as the southern Maryland community. What you'll see here is the main hospital building. Next door here is the ambulatory care center building, and this is where we have proposed for a new regional cancer center to provide top-notch cancer care for the residents of Prince George's County. Through here, you'll see the metro line, so you can see the very close access to the hospital facility. Again, a level 2 trauma center, a level 3 NICU, offering many types of services to the Prince George's County community, and at the same time expanding graduate medical education to train our new physicians, our new nurses, allied health professionals. And this is key because there are a number of medical specialties that are lacking in the county, and there's a shortage of certain physician specialties. And we really see this as an opportunity to address the access of specialties for the county. This is a picture again of the ambulatory care building, currently designed for 3 levels, but it has the capability to expand for additional 3 floors. And let me just go back to this one picture a second, because one thing that people ask about is, can this facility be expanded upon? And actually, we have a video on our website that you can see the phasing of potential expansion. But this can have a second tower of an additional 8 or 9 floors. Each floor would probably represent about 30 to 35 patient rooms. So that just gives you capabilities of the future expansion. As well as this facility here can be expanded to 3 floors. And then we have both vertical and horizontal expansion capabilities in the back. So this hospital chassis is designed to have significant growth capabilities as we expand. And you know, our whole goal is that we want to serve the residents of Prince George's County. Almost 6 out of 10 Prince George's County residents get their inpatient hospital care outside of the county. and we plan to change that. So let's go to the Bowie campus. And to give you a kind of a visualization, this is a aerial view, but you can see here the campus, and I believe it's close to 50 acres. But we have here basically the area of the emergency department here, and then the Mulliken Medical Office Building. Right here is the Larkin Chase Rehabilitation Center. And then off in this area here is some additional land for potential future expansion for medical services. So with our freestanding emergency center, we now see over 32,000 emergency visits a year. So the residents of Bowie are certainly supporting us, and we really appreciate them allowing us to take care of them. And we have recently done some improvements to the campus, but a lot of people don't understand, well, what's different between us and the urgent care center? And I think it's very important to know that this freestanding emergency center is basically a hospital emergency department. And it has the being staffed by highly trained nurses, being staffed by emergency physicians, and it has the support structure for quick diagnosis for patients. So this really is a really nice facility for the town of Bowie. And we recently completed a renovation where we went from 15 to 27 patient beds, and with some additional equipment. So if you haven't been in the facility lately, you know, you can call Joe McHale over there, our local administrator, and she'd be happy to give you a tour, because this really is a fabulous facility. And this recent renovation was about a $7.5 million investment into the Bowie community. And I think I would be remiss to mention Councilman Marcos, who really has spent a lot of time with the Bowie Foundation, being the chair, and they have certainly supported us on a number of different projects. So thank you very much for everything you've done for us. We appreciate that. So with the Bowie Surgery Center, we have 3 operating rooms, and we have 2 procedure rooms there, and we do approximately 4,000 procedures a year. We actually have some capability to expand our volume, and so we're working with existing local surgeons, as well as some subspecialty surgeons from the University School of Medicine who have interest in doing procedures there. So again, we see this as an opportunity of bringing additional subspecialty care to the residents of Bowie. The Larkin Chase Rehabilitation Center is actually a joint venture with Genesis Elder Care, and which Genesis has about a 75% equity interest, and we have a 25% interest. This is a 120-bed skilled nursing facility that has also rehabilitation services as well. And with the Mulliken Medical Office Building, there we have a number of various types of practices there. Some of these are community private practices, and some of these are associated with our community medical group, as well as some subspecialties such as cardiac surgery with Dr. Jamie Brown, and vascular surgery, Dr. Sarah Dewson from the University of Maryland School of Medicine. I'm going to let Tiffany Sullivan, our Vice President of Ambulatory Services and Population Health, to talk about these next 3 slides with Bowie, and to give you a perspective of what some of the things that we're planning on doing for the Bowie community.
Thank you. Good evening, everyone. It's exciting to be here, to have folks in the room to really get to see what we're excited about doing in this community. Moving on, we're going to talk a little bit about what we currently offer. Uh-oh, I broke it, Jeff. There we go. Let's see. Other way. There we go. Oh, sorry. I'm moving too fast. All right. It's got to mess up when I get up here, right? So our marketing campaign, really to increase the awareness of what you guys already know, is a gem and a jewel in your community. We really need to make sure that all of our residents in Prince George's County really know and understand what we have going on at the Bowie Health Center and the Bowie Health Campus. We're also planning to expand our critical services to include some subspecialties. You heard Jeff talk about cardiac surgery. We really want a bigger presence in the surgery center and on the campus in cardiac surgery. And we do have a tie-in with the University of Maryland School of Medicine for pediatric congenital cardiology as well, which is a specialty that we could bring to the area. We also plan to increase our presence in GYN and GYN surgeries that can be performed in a surgery center. You know, nowadays, most of our women don't want to go into a hospital to have those type of surgeries. But we can offer them in a surgery center location, and we're building our women's health program to include specialists that really know how to work with our women and get them into that type of care. We're also examining opportunities to broaden our surgical specialty use of the ambulatory surgery center. We want to make sure that if the procedure can be done in an ambulatory surgery center, that our community has access to it at the Bowie Health Center, so that if there is a specialty that we don't have, we're taking a look at what we have at the hospital and at the health center, what we don't have, and how we get those specialties from the community or in our partnerships with the University of Maryland into the Bowie Health Center. And it's still not going to work for me, but that's okay. So I want to talk a little bit about what's coming up soon in the University of Maryland Capital Region Health Medical Group, some of our expansion plans. We have Sierra Dewson, as Jeff mentioned, who in Q1 of calendar year 2018, we plan to expand what Dr. Dewson will be able to do in the Mulliken Medical Office building. Vascular studies, varicose vein treatment, and venous ulcer treatment are all services that are included in what Dr. Dewson can provide as a vascular surgeon in the outpatient setting. So it's very exciting for this area. We also have a number of maternal fetal medicine physicians that we've brought on board who can be able to offer that service for women who are facing complex conditions before, during, and after a pregnancy. And that's what Dr. Kerry Lewis and his group, we're doing a lot of expansion in the women's service line. And then Mark mentioned to you earlier about our work in population health management, and you heard him say we actually don't want everyone to come to the hospital. And that sounds like you guys are probably saying, what do you mean you don't want people to come to the hospital? Why are you building a hospital if you don't want people to come to the hospital? We want the right patients in the right setting for care. And for example, if you're managing a chronic condition like diabetes or hypertension, we should help you manage that in the community. We shouldn't have to help you manage that in the emergency department or even in an inpatient bed. Those are what we call conditions that are ambulatory sensitive, and working with your medical team, working in the outpatient setting, we should be able to help patients manage those conditions. And so we're working on making sure that we have access to care plans and care management for patients, even if they do have an emergency department visit. How do we prevent that next one? How do we prevent that next inpatient stay? We really are dedicated to that. I mean, that's why I was brought here I'm a Southern girl, Mr. Lott, so you're from Georgia, I'm from South Carolina. You're from Alabama, so that's a little different. But one of the reasons why I was brought here, it seems counterproductive, but it's not. That is where we should be providing the care to the patients in their home setting. We want them to be healthy at home, not necessarily sitting in our EDs and in our inpatient beds. So those are some of the wonderful things that we have coming up. And Mark, are you going to come back up and talk about ways you can help? Or you want me to just keep on going? I'll keep on going. So here tonight to introduce you to some and reintroduce you to others to help really earn your trust in this community. There's been a history here, but we want that history to be much better going forward. We really want to involve our community. We want to hear your voices. We want to know what you think about our plans, what we have going on, and we want you to be involved in those plans. I always say I don't want to give something to people. I want to create something with a group of folks. It's better if we work together that way. We want to take care of you and your family, and we want that to be top-notch care every time that we provide that care. But if we ever make a misstep, we want you to feel comfortable letting us know that we did so that we can fix that. We want you to participate in our fundraising efforts. Linda Dorman is here, our chief fundraiser. I'm giving her a new title tonight. But Linda oversees our foundations and has been a wonderful part of our team. So we really want you to help us and participate in those efforts, and then become an ambassador. You'll have copies of this presentation, I'm sure, Mark, if you want electronic copies to share with others. We really want you to be able to speak about what we shared tonight, represent us wherever you are. You're in places in the community where we're not. You're in your churches, you're in your group meetings, you're in your sororities and your fraternities. We want you to be our ambassadors there. We want you to share this great news about what we have going on in Bowie and in Prince George's County. Thank you.
Thank you, Tiffany, for that, and I like that. So, okay, everybody raise your hand if you're going to be an ambassador for the new system. So that's what we're trying to do tonight, is to let people know and become aware of the transition. Obviously, we've talked about this, like I said, for at least 5 or 6 years at the county level. It's probably going a lot longer than that. If you talk to Audrey Scott and others, and Mark, given your experience as part of that. But we're at a point now where we're moving forward with this partnership, and I think we're all excited about it. Obviously, Mark also mentioned that there are some challenges coming up, obviously, depending on what's happening in the healthcare field, particularly at the federal level. So we may be engaging you in other ways as well if you're interested in this subject matter. Before we open it up to questions, I do want to introduce a colleague of mine who made it up from the dark, deepest parts of Prince George's County in the 9th Council District. We have Councilmember Mel Franklin here. Thank you, Mel, for coming out. And I will say I appreciate Mel for being here, who is chair of the council for 2 years during this transition from the memorandum of understanding that was signed in 2012 to get us to this point. He's been an advocate for this project, and actually an advocate for making sure that businesses and residents of Prince George's County are involved in the process, whether on the board or have the opportunity to participate coming forward. I know Orlin talked about that as part of the opportunity to build stuff and to be involved and provide vendors an opportunity to provide services to the University of Maryland medical system. So with that, I do also want to recognize and say thank you to Joan McHale, who has been serving us for years now at the Bowie Health Center, Healthcare Center, and continues to do the good work, and her staff who are here as we transition into this new thing. With that, what I'd like to do is open it up for questions. What we will do is we'll take one of the mics. If you raise your hand, we'll come around. I might ask Mark or maybe Neil to come up here to this microphone to be able to answer any questions that you have. No, that's fine. So. All right, just raise your hand if you do have a question or a comment. Okay, we got one right here. Just introduce yourself and who you are, even though I know who you are.
Thank you. So thank you for coming out. Appreciate this opportunity to converse. I'm Gavin Stokes. I'm a board member of the Community Association of South Bowie. And we are a very active organization and very interested in this project. One question I had to tug on a string you said about entrepreneurial hospital. So with the competition that there is in the medical arena, is there a focus on a certain niche that the Prince George's County Hospital will have? So for example, when my mother fell ill and had to get some specialized treatment, there was only like one facility in the state of Maryland, no, 2 facilities in the state of Maryland that had something called CyberKnife that I would say saved her life. And so it's a very specialized treatment. And my question is there a plan to focus on a certain specialty? Because I heard a very general list, but is there a focus area that will be unique to Prince George's County?
Don't all jump up at once.
So I'll start, and then we've got some other people here that can talk about this. I think for the regional medical center, what we're trying to do is take some of our existing programs and strengthen them. You know, certainly we look at trauma. So we want to do what we can to strengthen that and have some additional, perhaps subspecialty coverage that helps support that program. When we look at cancer, we want to develop a comprehensive program where we have the latest in technology, for example, for radiation therapy, like you mentioned, like CyberKnife. You know, we want to offer these things such as clinical trial programs. So perhaps maybe by working with the University of Maryland Medical Center, we could develop clinical trial programs taken from the ones that they're basically managing through NIH. And then that way, we're offering clinical trial programs within the county versus county residents having to go into DC or go into Baltimore and so forth. So those are just a couple of examples. Certainly, we think we've made strong efforts in our cardiothoracic program here, as I mentioned before, being in the top 10% nationally ranked. And we want to work on vascular surgery as well. I think also with some of the programs related to surgery, certainly we would be looking at robotic surgery, and there are other types of minimally invasive type technology that we would bring into the regional medical center as well. So this regional medical center will be hot wired. It will be very technically advanced, and that's not only within the facility, but also the equipment that would be going in there as well. Dr. Hall, and if you had anything you want to mention?
So when you look at some of these subspecialties, you either have to have the training, the personnel, or the equipment. So I think as time, and Jeff is right, we want to strengthen what we see, but also we had the community needs assessment that was done regarding the top diseases that are affecting the residents of Prince George's. So we want to make sure that we're actually going to be focusing on those top diseases, that the things that happen most of the time and often, but then again, there may be some things that are so subspecialized, you still may have to go to a center because again, you want people to do it who's doing it often, and then being able to get the technology and the resources and the trained people to come here for things that they will be treating more commonly. So it will be coming over time. So remember now, we just had this affiliation, we're going to, hit the ground, and we have 3 years to build. But as we're looking at progressing, strengthening, and as time goes on, being able to add on faculty, add on programs, and also add on the equipment that's needed to be able to support it. Does that make sense?
Add one thing. Let me just add one thing that that I think might be helpful. If you kind of understand the scope of, for example, University of Maryland Medical System, a hospital there in that region, we probably get in over $500 million a year from NIH, which means the research dollars that we have that are available in the system right now are some of the things that will start to spread to other operations as well. And I'm probably putting on my old Board of Regents hats, but one of the other things that's really critical about this is a combination between the University of Maryland College Park and UMB, tech transfer, the ability to really work on new and adventurous new business ventures in the medical field. One of the things that we also have here in Prince George's County we don't talk a lot about is our middle school program that we have over at Largo and at the college, the community college. There we have cohorts of about 100 students every year that graduate with their high school diploma and their AA in healthcare. So it's a focus in that area already. So when you start taking a look at the bigger picture, what we're talking about from a county standpoint, tech transfer between things like robotics and how do you put basically what I would call technology into medicine, having that type of activity taking place here, hundreds of millions of dollars that are already in the pipeline as it relates to research, and some of the top researchers, probably even in the United States, we have working in some of our aspects of the system here. So when we start talking about things from an entrepreneurial standpoint, obviously what we were doing in terms of bringing more activity from a surgical standpoint, but even some of the other nuances that really drive economic development, drive getting more jobs in the area, getting our students who are graduating from our high schools and our colleges plugged into the system, it now becomes a full scope of activity as to how you see the benefits. And that's where we like the idea of being able to drive all the activity that gets all the way down from a granular standpoint, so you get great health care, but you end up with great jobs and great facilities all at the same time.
Okay. Any other questions, Audrey?
I want to pitch in with just a little bit. So, now my wheels are turning. just a couple of points to add on here. Orthopedics. Orland touched on College Park. So you may be somewhat familiar with what's going to happen with the old Cole Field House and this major, major commitment to treating athletes, treating the campus there, conducting really advanced orthopedic research. All that stuff will filter to the Largo facility. And the other is, remember the breed of cat we're dealing with here, academic docs. That what they want is the most advanced technology possible. Our challenge is going to be, what can we afford? How do we keep up with their never-ending demand? So this is a different dynamic here, is they're going to insist on the most advanced technologies. And we're going to learn a lot more about the market as we go.
This is like
This
a
is going to be
dream.
a softball, I know.
Yeah, thanks. This is like a dream come true, and it really is exciting, and wish you all kinds of, obviously, success. I have kind of a related question to the previous question, and that is, how do you, or are you prepared to respond to the cardiac approvals for Anne Arundel Medical Center?
You should take that one.
So, as you know, currently the cardiac surgery, we have obtained a stay for not allowing Anne Arundel Medical Center to move forward until and it has now been placed in the Circuit Court of Prince George's County, and it's before a judge right now who will make a determination as to whether or not she would overrule the decision by Maryland Healthcare Commission. So we are hopeful that what will be recognized is that if Anne Arundel Medical Center were to implement their cardiac surgery program, that it will have significant impact, negative impact on Prince George's Hospital program. And so we're cautiously optimistic that one will look at the data and the judge will look at the data and make the right decision regarding what we have opposed right now that is before her.
When do you anticipate a decision might be made?
We're not sure. It is my understanding that the judge has more than ample time to make that determination. I don't know if Judge Williams may have some thoughts as to how that will shake out.
Yeah, Judge Beverly Woodard, the Prince George's County Circuit Court, took the case under advisement. It was a long hearing. Tim Maloney represents us, and whoever wins, whether Anne Arundel wins or Prince George's wins, I can tell you now it's going further. So it's going to be litigation. It's going to last probably a year and a half. But the longer it takes, the better for us. So that's where it is right now.
Just some additional comments so I can bring you up to date. The cardiac surgery program at the hospital, we restarted that program, and there was reference made to Dr. Jamie Brown. About 2.5 years ago, we restarted our program. That program has been successful so far, and you heard about the quality outcome of that program, where we have now one of the highest rank in cardiac surgery programs within the top 10% in the country. That program has been very successful. Some of the market share areas that Anne Arundel Medical Center has indicated where they'll draw market share from are some of those within our service area here in Prince George's County. So what we have done is we've challenged that if they were to get approval, it will impact on our program. That program, like I said, it's doing very well right now, but we're afraid that if some of that service areas is impacted, we will have a decline in the numbers that we've had so far. And
All right, we have a question back here.
Good morning. Good evening. My name is Jeffrey Cooper, and I have a question for Mr. Moore. What is your plan for supplier diversity here at the new medical center. My concern is that from a provider standpoint, that we already have local resources, we have providers here locally, and we don't see any attempts made to include them in the mix. I mean, from construction to as well as medical providers. So, you know, what is your plan to address that? And the second question I have has to deal with pediatric services. I'm very concerned when I hear that the state of Maryland funds 14,000 asthma patients were sent to Children's Hospital for services that could have been handled by primary care providers here in Prince George's County. That's a very troubling figure to me. I understand the mothership is in Baltimore, but I think that disparity of services is putting local pediatricians out of business. And when you only have 8 beds, I think you said pediatric beds available, or that you're only allocating 8 beds for pediatric services, my concern is that the vision or the strategic plan for this hospital should be reevaluated, that we really build this hospital for future needs, which is less on hospitalization and more on revenue generating services that meet the needs of the community.
Let me do this. I'll take the MBE part of it, and then I'll turn over the pediatric issues over to the other side of the table here. But just so you're aware, actually, it was probably about maybe like a month and a half ago that we actually had a large session in Baltimore where we were inviting in a number of organizations that are engaged in MBE activities and vendors from a construction standpoint all the way down to supplying activities for the hospital system. One of the things that we're focusing on right now is we want to make sure that our vendors that are doing work, for example, in Prince George's County, start meeting with us so we can start talking about how they can start doing things with the system even prior to the hospital coming up here. One of the ways that we're doing that is we're going to be doing some more vendor activities. Next year's vendor activity will be here in Prince George's County. So that's a big part of what we're trying to do, because right now you have a lot of activity that may go on, for example, in Baltimore. And believe it or not, when we asked at that particular meeting how many people there were from Prince George's County, it was probably half the room. So we're looking to hopefully improve upon that. Let me just say one other thing, and then I'll let you jump back in. The MBE activity is a very serious activity, and supply chain activity there may be one of the best programs that I've seen on any of the boards that I've ever worked on. Probably about 7-8 years ago, we were probably at about 7% as it relates to MBE activity. Right now, we're at approximately 28%. And the reason that we have gotten there, I think, is because of our subcommittee that's chaired right now by Catherine Pugh, who's obviously the mayor of Baltimore, but has been chairing this for quite some time. And we've been focusing on really driving numbers. We drive numbers so we're clear on what's going on from the African-American community, the Asian community, women-owned businesses, and we actually do have some Prince George's companies that are actually doing quite well, and we are looking to expand the activities that we have with them. We have a couple of Prince George's County that are doing 7 figures with us right now, and we're looking to expand that. One last thing I'll mention, and it's kind of an inside baseball, but one of the things that we're looking to do is to create a specialized mentor program for Prince George's companies. One thing that we're doing right now is we have some programs that exist as it relates to numerous entities from different parts of the state, but with us moving here into the county and not having all the relationships here we'd want, we're looking to put about 3 or 4 groups that will be part of our mentor program, a program where they come in, learn how you operate in a large system, learn how you might be able to put your proposals in place, and then hopefully we're hoping to keep people in there for a 12-month period and then basically getting them back out into the market to be able to operate. So it's not supposed to be something where you kind of come in there, you hang out in there forever. It's really to prepare you to be able to figure out how you really impact what's going on from a system standpoint.
So, Mr. Johnson, as a board member, what is the dollar commitment on this new hospital that you have in policy that you committed for an MBE spend? What is that dollar?
Well, let's think about this from an eligible spend standpoint. And what we're looking at is percentage of eligible spend. So if we're looking at an eligible spend of a couple $100 million, we're also talking about a percentage probably in the 20s as it relates to that for MBE transfer activity. So a real percentage that we look at every meeting is, where are we? Even to the point where we look at every project that's coming down the road. If there's going to be a $40,000 project here, we want to see what the MBE number is. If there's going to be a $50 million project here, we want an MBE number as it relates to our eligible spend. So in terms of the eligible spend that we're looking to, having numbers in the 20 to 30 to $40 million on programs that are moving forward are something that we're going to be operating on. Construction, I'll give you a perfect example. We have a company that called Mahogany in Baltimore that actually started in a mentor protege program with us. At this point, we can send Mahogany out to do $30 and $40 million projects. And even when this minority company goes out to do $30 or $40 million projects, we will also ask them to hit an MBE number. So it's not just a matter of you might be a minority organization, we still want the MBE number hit even on top of that. So we are continually looking to build and to find more groups that'll be in line. We had a number of companies we've already started to talk with. We have a great supply chain group. We have some individuals there we can make sure to put companies with. So if you have something specifically that you're looking to get involved in, please just let me get your information. We get it over to the team, have them hopefully get in contact with you, and we see how things will come together from that standpoint. But it's a very serious part of what we do, and we spend a lot of time working on it.
The other thing I'll mention is obviously because this is a new partnership, we've had a lot of conversations as part of this new partnership about trying to meet those kind of goals as part of that. So that's something that we'll continue to monitor as the county as part of the memorandum of understanding and the future agreements that we have.
Just to remind you, Councilman Turner, Councilman Franklin, County Executive Baker, we had quite a number of consultations on this. We have an MOU. We have committed to percentages both in the construction and maybe more, as importantly, the ongoing purchasing and procurement that we do. We take this very seriously. As Orlin was saying, you know, we believe we have a stellar program now. We're learning a few new tricks here in the county about county MWBE. And you'll stretch us a little bit as we go. But I think our message is we're doing it. We've done it so far pretty well. Our board holds us accountable, and we have an arrangement with the county, which is another layer of accountability. If you give me your business card, we'll figure out how to blend you into this process.
Absolutely. And I think the other part of your question was two parts: community physician engagement, and then what we're doing to really help our patients with asthma manage their condition. So on physician engagement, we've had 3 sessions so far, physician town halls, clinician town halls at Bowie, Laurel, and Prince George's, and we plan to have more where we want to hear from our community physicians, those who may have privileges with us and those who may not, who have had privileges in the past but maybe want to come back into the system and they want to be reassured and rebuild that trust with us. So I'll get your card and make sure that you're included in that and that you can also invite others to that. It really is an opportunity for our physicians to really give us some feedback and share some information with us as we rebuild some of those relationships and strengthen others. With asthma education, you know, in my previous life, we found 2 things very critical to preventing asthma attacks, and I'm sure you know these things. It was access to maintenance medications and education for the families of children managing asthma. We also have a pulmonologist who is an employed physician in the Capital Region Health Medical Group, Dr. Nanavati, and as our employed pulmonologist, we have Dr. Nanavati in a number of practices throughout our medical group. Seeing patients, but also making sure that our family physicians and our internal medicine physicians have the latest and the greatest on how to manage their patients who are managing asthma education. We'll start to roll out as well group visits for patients managing asthma. We know that in that environment, in a group visit environment with other patients, our patients do a better job of managing a chronic condition. So we're rolling those out for asthma, and we're rolling that out for diabetes as well. Did I answer your question?
Okay,
You look a little skeptical. Just want to make sure.
So we got one more question back here, and then we'll try to wrap up the program.
This question on
diversity is very, very important. And you've raised an excellent question, and I want to say as a board member, I continue to hear complaints about a number of groups that are not getting involved in what's happening and so forth. And all I can say is this, Orlin is on the MBE committee. I'm on it. I think there's a good faith effort by the committee to reach out and try to give more work, not just in construction, but also in procurement and also in investment. And so we're looking for more and more minorities, women, Asians, African Americans, and others to make sure that the county commitment that they gave to us to see that there's diversity and also involvement of local businesses and firms come into play. And I would simply assure you that those of us who are on the committee, along with Mayor Pugh in Baltimore, we're doing all we can to make sure that we monitor that situation and that there's fair play that's going to take place in the expenditure of public dollars. I also am in contact with the members of the Legislative Black Caucus, and I've also keeping them abreast of what's happening and so forth, because they ask me all the time. Your question is a great one. I'm aware of it, and I know Orlin Johnson is aware of it. We're going to keep you abreast of what's happening in that area, so thank you for the question.
Thank you so much for bringing quality services to Prince George's. I'm Sharon Hunt, and I'm a parent of a child who had major mental health challenges for many years. And it's my understanding that with the new system, there's not going to be services, behavioral health services for children, just for adults. So if you could address that, please.
Yeah. As a state, we do not have enough resources for behavioral health, especially in the pediatric and adolescent community. When we look at our major systems that actually do inpatient, so we have inpatient and we have outpatient, and obviously we have community providers, there is room, and as we're doing more studies to look and see where our volume of patients and where they're going, there is a need. So currently, Laurel has an inpatient behavioral health unit and also Prince George's, but you're right, both programs are for adults. When you cross over into pediatric and adolescent, there's really a special training as well as infrastructure that you have in place. We are actually overwhelmed with just dealing with the adults. We actually do not have the capacity actually to have children in that population actually to address. So you are right in saying that there's difficulty in placing those patients, because we do get them in our EDs, including in Bowie as well as Prince George's, and there is a need for more services. But the question is who's going to be able to provide it, and then looking at the program and the infrastructure to be able to support it. So I actually don't have an answer, because right now we're already busting at the seams and even being able to address the adult population.
So one thing, there's ways to get creative in doing telepsychiatry, right. And you have residents, as you call it, your mothership in yep. Baltimore. So if there's ways that you can tap into those child and adolescent psychiatrists that mm-hmm. are placed at the hospital to do telepsych in our various centers in Bowie, at Prince George's, Laurel, it would be a way to help with that. So really meeting with parents such as myself, the county actually has a system of care grant for the next 2 years. We've had it already for 2 years to improve crisis mobile mm-hmm. response and stabilization services in the county. Would love to be able to work with you Absolutely. All as you develop and think of creative ways to do this through telepsych or whatever.
We started to have those conversations, and actually just last week we met with Jill Reckenbeisel, who's the chair of psych at the medical center. So we're actually looking at what we can do to expand our services, but we really have to focus on outpatient and preventative care. If we can get a lot of the children that are having issues and get them the resources for community psychologists, social workers, as well as in med refill clinics, and being able to get them into partial hospitalization, not necessarily inpatient, but really being preventative, and also working with the crisis units in the community to be able to address them, especially working with the school systems. So we'll love to talk to you afterwards. We're expanding our services. University is actually giving us some help now, and we actually are looking at telepsych, but also telemedicine for a couple of subspecialties that we don't have the ability to take care of here in Prince George's. So we'll be expanding on those telehealth services.
All right, so thank you. I think that'll be the last question. I think our representatives from the University of Maryland Medical System will be here for a couple minutes after we finish the program this evening. I do want to thank all of you for coming out. I will say that question does raise an issue that we've had discussions at the county level about not only our partnership with the University of Maryland Medical System, but our partnership with other healthcare providers in Prince George's County, both public and private. And so I know there was a lot of discussion about what having UMS come into Prince George's County would mean for other providers that have been providing long-term services to the county. One of those discussions was about Children's Hospital and trying to develop a relationship. So if there is a gap in service, let's try to have that relationship so somebody can fill that gap. So I think that's something, the old saying, you got to crawl before you walk. And, so we're literally 2 months into this formal partnership, even though it's been in discussion for years. And so we're trying to get us standing up, maybe crawling first before we start walking, and then hopefully shortly running as well. So I want to thank each of you for coming out this evening. I do want to say a couple of kudos. One person who was mentioned earlier, I want to thank Tamika Bumry, my chief of staff, for helping to organize it, as well as Una Cooper on behalf of the city of Bowie, and Al Lott, her boss, for their assistance in putting this together and making sure we're be able to stream it, and it'll be on Bowie Access Cable if people want to see it again about what's coming. I did also want to mention, many of you probably might have gotten this in the mail in the last couple of weeks. It's called Maryland's Health Matters. It was a publication by University of Maryland Medical System talking about what the Capital Health Region is about. And so I would encourage you, if you didn't throw it out already, it's a good resource for what's going to be occurring into the future as well. With that, we want to say thank you again and have the mayor come up and say some closing remarks.
Thank you, Todd, and thank all you folks for coming today. And all of you folks from the hospital system, thank you for what you're doing. You are not only a quality of life entity, there are occasions when you are a life or death entity. And as you build on the future, our whole community benefits. While I was listening to this, Diane and I spent a lot of time with the Scouts. And there's a process in there where before a young man becomes an Eagle Scout, he has to go through a review process. To show you how smart some of our kids are, and I'll tie it into the medical thing. I'm sitting there asking this young man what he wanted to do. And he said, I'm going to be a doctor. I said, well, what kind of doctor? He says, I want to be a neurosurgeon. And I said, well, where are you going to go? How did you pick your school? And he said, it's simple. I called a number of hospitals and I asked them where their best neurosurgeons came from. And then I called them back and I said, where do your best medical school graduates come from? And then when I went back to the medical schools, and then I called them and said, where do your best undergraduate students come from? That's where I'm going to school. So they started at the end and worked back. And so these are the kind of people that you're going to be dealing with. They're smart as a whip. They're smarter than at least some of us. I'm intimidated by a smartphone. But like I say, you guys have a special part in our community. You have a special part in our life. Those of you that have anything to do with the health center, I think I have a wing on that building for all my kids. I think all of my children have visited you frequently. Matter of fact, I was going there so often, I think some of the judges' people would be probably looking at me for a while. But every time I've gone there, we've had incredible service. Every time that my neighbors talk to me about it, they say it's incredible service. And it also ties into the point that you made. We're a growing community. We're a strong community. I brag on this community all day. We're the strongest, most diverse, most family-friendly community in the region. And it doesn't do that unless it continues to grow. And it grows through economic development, grows through quality of life things, and they're linked together. So what you do has a long-term effect not only on our health and our lifestyles, but the growth and stability of the community as well. So continue what you're doing. If there's anything we can do to help, we're here. Like I say, we'll gladly beat on our county council and our county executive to make sure the funding is there. And it's on you, continue, you interact with county and state officials all the time. Don't miss an opportunity to say, what have you done today to help us move this hospital system forward? Because it's critical to our future. Todd, thanks for putting this thing together. You all have a safe drive home. Remember, everybody out there is going in a different direction, but be careful. We've got big holiday seasons coming up. I want to take an opportunity to wish you all well, and I hope the holiday season does well for all of you. Good night.